This law enacted the largest expansion of Medicaid since its inception, covering half of those newly, quote, insured, unquote, through this government program. Now, as a former governor, I know you can appreciate this terrible burden and cost this law is placed on the back of our taxpayers through state mandates. Now, I've had the Congressional Research Service look into the waiver provided under Section 1115 of the Social Security Act, and they confirmed that you have the appropriate authority to lift the maintenance of effort requirement. Now, will you utilize your authority to help cash-strapped states avoid gutting education, law enforcement, and other state priorities?
We are working very, very closely with my former colleagues and the new governors across the country. In fact, we have about 17 state teams in place and are in the process of looking at everything from individual 1115 waivers to strategies to lower Medicaid costs. In 2014, when the Medicaid expansion is scheduled to be in place, as you know, the federal government is picking up 100% of the costs of the newly eligible Medicaid recipients for a period of 3 years, and gradually that cost sharing decreases to a high of 90-10.
How is the federal government going to do that? I mean, it's broke.
Well, I think that the expansion is paid for as part of the overall health care bill. As you know, this is one of the few acts passed in health care in a long period of time that is fully paid for within the confines of the legislation, so that the unlike the Part D prescription benefit, which was not paid for and continues to add to the deficit, the Affordable Care Act is fully paid for.
Madam Secretary, your department has granted well over 1,000 waivers. Yesterday in the House, Steve Larson testified that 95% of the waiver requests you've received have been granted. That's 94%. That strikes me as a very high percentage. Can you convince the committee that you're not simply granting nearly every waiver that you get to limit the amount of griping and complaining you get between now and, say, November the 12th, until you are more transparent with the process you've earned this kind of criticism? So,
Senator, the waiver that you're speaking about deals with one section of the Affordable Care Act, and it's the ability of policies to pay out up to $750,000. Again, we were given specific language in the statute about market disruption. We are looking at those cases, and before there is an available affordable option to have an alternative to the so-called mini-med policies, the vast majority of them have been granted. Some coverage is better than no coverage.